Well, India is walking into a health emergency, and this time it's not about hunger, but it's about excess. A new UNICEF report warns that obesity is rising sharply across age groups. Children, teenagers, and adults are all gaining unhealthy weight at alarming rates. Globally, obesity has now overtaken underweight as the most common form of malnutrition among school-aged children. In India as well, the problem is lead. Processed food is cheap, heavily marketed, and easier to find than fresh produce, even in schools for that matter. Now, UNICEF has called this a triple burden: stunting, hidden hunger, and obesity, sometimes showing up in the same family too. Unless policies change fast, millions could be pushed into long-term health complications that are expensive to treat and also harder to reverse. To take this conversation ahead and decode the UNICEF report on rising obesity in India, joining us is Marie-Claude Desilets. She's the Chief of Nutrition at UNICEF India. Good morning, Marie. Hope you're doing well. Let's talk about this very important story. Your new report shows childhood obesity rising worldwide. Where does India stand compared to other regions, other parts of the world? And tell us a little bit about what you thought was most concerning in the Indian context.
Okay. Globally, the Child Nutrition Report found that today we have 20% of children 5 to 19 years old that have overweight and obesity. Overweight is having a little bit too much weight and too much fat, and obesity is much worse than that. It's the worst form of overweight. So globally, too many children today are overweight or obese, and the worst disturbing into that is that now 42% of them, among these 20%, 163 million kids around the world, are obese. So they have the worst form that has the worst consequence for health also. So they're much more at risk of hypertension, diabetes, cholesterol, and other heart disease and other body disturbance at a very young age, and these are lifelong disturbances. What we see in South Asia compared to the rest of the world is still a bit in the good shape, with lower prevalence of overweight and obesity in children. However, South Asia and India also have the highest number of children. So if we do not act today, in a couple of years, that we will see an increase, a very large increase in overweight and obesity in children, and that will be very, very preoccupying, if I can say. Now today, India has about 4% of overweight children, and possibly that by 2030 we will reach 27 million. So this is also a crucial thing to keep in mind, that India will follow the world path toward this increase in overweight and obesity.
So you're saying there's scope for improvement still, where at a time that we can still go back, improve the story in the Indian context. But you also interestingly highlighted, Marie, how India is facing the triple burden of malnutrition, which is stunting, micronutrient deficiencies, and obesity, sometimes in the same family. Is that unusual to you? What do you make of that pattern?
Effectively, malnutrition is linked in different forms of malnutrition, is linked also with the family diet pattern or the food patterns. If the family does not eat well, it reflects habitually on all members of the family. And this is why we measure this malnutrition mostly in children. It gives us an indication of what is happening also in the household. And we know, and it's documented, that if the parents are overweight or obese, many times the children are also overweight or obese. It goes with the family ambience, the family dynamic around the food that we're eating and the type of physical activity that we do. These are two combinations that lead to overweight and obesity.
Marie, the NFHS shows overweight rates among under 5 children and how they have more than doubled in just over a decade if we just look at the last 10 years. What's driving this rise at this rate and at such an early age?
There are different drivers for that. The first one is the unhealthy food that is available everywhere. Everywhere we go, we can find a stand with some chips and some with cookies to eat. We have apps that are leading us to order things that we don't necessarily need, and they just look good or they might taste good, so we just order them and we eat them. There is the easy access to the food. The second one is also the ads by the food companies. We are bombarded, and children are much more bombarded than adults with ads, because it's the way that the food companies, the food and beverages companies, target them with the AI flow, artificial intelligence flow of personalizing and adapting, targeting children through whatever they access in their social media, in their games, in others. The ads are really influencing children in their food choices. The other one is also the food companies, the food and beverages companies, that are also a bit influencing or meddling with how government is trying to speed up decision, but also the food industry is trying to slow these decisions, because their interest is to sell us their product, not to have some barriers to sell the products. So this is also a challenge. And the last one is also the governments that needs to think about a different package or multiple policies and regulations that needs to be put in place. It's not a one-size-fits-all. There is a panel of different things that needs to be there to drive a bit more or to limit the availability of these unhealthy food.
Very rightly put by you, Marie. It's actually a story of clashing interests to an extent as well. Now, to what extent that's impacting children is what we're trying to learn from you, decode here on The Breakfast Club. But since you spoke of how ordering food is just at a click's distance, what did you find in terms of rural versus urban? How different was it in the rural scenario, Tier 1 cities versus Tier 3, for instance?
Globally, before overweight and obesity was really a question of rich countries. Now today we see this happening in low and middle income countries. India is part of it, but not only that, not only in the wealthy household, also in the poorest household. So even the poor, when they want to make food choices, they go for the easy, convenient packaged food instead of maybe choosing healthier food items that are on the market. So in India, rural areas are still a bit okay compared to urban, but it won't last. And we even see in some states it is more and more documented by different academic groups. Tribal areas, for example, children in tribal areas are extremely vulnerable to overweight and obesity, and they show already issues with hypertension, diabetes, and cholesterol.
Okay. Well, Marie, your poll also found packaged snacks, sugary drinks, how they're more available to school children than fresh fruits and vegetables. From UNICEF's perspective, where are we going wrong? What stage are we looking at? And let's talk about solutions too. Where do you think intervention starts here? What more can be done? Because at least on other levels, for instance, government offices, etc., we're seeing these sugar boards now being set up. Slowly we're moving to that phase too. But tell us a little bit about the trend you witnessed in schools overall.
It starts with everybody at different levels. We need the government to get into the course for limiting food and beverages marketing and sales, and find different ways for the production of healthy food. We need the media, for example, to really continue to raise awareness and help the government to raise awareness of the population of what it is healthy eating. We need the parents and the children to really think about their food choices. We need when they know, we know that packaged food and chips, it's not the best way to go in a day, but still too many of us are choosing this kind of food. But this is a choice. So we need to also consciously and look at what is the pressure that we have around us that is pushing us to do this choice. The convenience, the easy access, the cheap price, the ads that we're bombarded with every day, and children are really more exposed than us, like I said. So we really need to think about this. In the school also, FSSAI has banned the distribution of free unhealthy food. They have some regulations also on what is the perimeter around the school where unhealthy food should be sold. However, these are not mandatory yet. These are just propositions. They need to be made mandatory. They really need to be enforced and monitored.
And can you cite some examples for us? So you've broadly told us what can be done, and it needs to be a collective effort with as much participation from the government, from parents, from school authorities. But what are examples of nations where such interventions and timely interventions have had a positive impact?
Mexico is one of the countries, Mexico, Brazil, Australia, Canada. These are countries that have taken measures and that I've seen some changes in the food choices of adolescents without reducing strongly the overweight, because it's extremely difficult. They at least mitigate the increase of the overweight and obesity in children. And it's really about limiting the marketing of the food and beverages unhealthy product. It's really controlling more the school environment, not serving good healthy food at schools, and ensuring that around the schools children don't have easy access to this unhealthy food. And it's also mainly about the ads, sponsors of events. We were seeing sponsoring by tobacco companies before. Now we see food and beverages industry sponsoring. There is a way to not have them and to have instead bank, health insurance companies, food stores, clothes stores, and other type of marketing that is not linked to wrong behaviors or to suscitate us to the desirability of eating unhealthy food.
We've heard the word marketing so many times in the last few minutes we've been speaking to you, Mary. So while you're laying emphasis on that and how marketing of junk food is a culprit, real culprit here, if you had to come up with a solution, if you had a magic wand, for instance, to create an intervention in marketing in your own way, what would that be?
A very good question, because there is no magic wands and there is no country in the world that have a full set of regulation and policies that work. Uncovered, and different tests and trials and errors will need to be made all around the world to try to tackle this. Marketing is one. Marketing on TV, marketing on internet, this can be easily regulated by government and fastly. It does not take that many years to do. Digital marketing is something that I think nobody cracked yet. So we need to figure out how to deal with the digital marketing. Other things that government can do easily is front of pack labeling. We know FSSAI is working on it, and everybody expects soon to have a decision. It will take time to take place, but this is one way also to better inform the population and the children and their parents about what they're buying. They're spending their money on what type of food. Is it healthy or unhealthy? So these are easy type of things that can be done to tackle the situation. The fastest one, I would say. Others needs more time. It's about the regulation, the laws with the food industry, what they can put in the product, what they cannot put in. How do we define high fat, high sugar, and high salt product? India still does not really have a good definition of this. So what is it? And for this, we can do regulation, but we don't have yet a good definition. So there are still steps to be done in India, but work is ongoing. So I have trust that we will come with the policies and regulation in 2-3 years, really to have a good package.
Now, Mary, all of this is the ideal way, the correct way to go about it. But I'm going to ask you a slightly different question now, because a lot of parents are struggling with this one aspect, which is a big aspect of this entire story. Parents often feel powerless when children are surrounded by delivery apps, so many advertisements, tempting ones at that. A lot of peer pressure. So your friend, for instance, is ordering food from outside. How can you be left behind? Too much discipline is also tricky because kids then rebel. So what practical steps beyond modeling behavior can caregivers, parents, guardians realistically take at home to encourage healthier eating habits?
As parents, we need to keep in mind that we are not born with a desire for unhealthy food. This is something that is put into us. So when you have very young kid, it's better to use home-cooked meal, home-cooked food instead of biscuits and others processed food, because you develop the taste for the food in the mouth of the child. And more it goes, if you give the unhealthy food, it becomes an habit. Children like sweets. Every children around the world like sweets, like fatty things, and like salty things. So more you give it to them, more it becomes a habit. More it is a habit, more you cannot stop it, and you really have crying children who don't want to eat because they don't get this sugar rush and the good taste of fatty and salty food. You have adolescents who are just not used to eat home-cooked meals with good taste and fruits and vegetables without all these additions on it. So behavior, food behavior is very hard to change. We can just think about ourselves first. What do we like? What we don't like? We're all different, and it's very, very the hardest behavior to change among all behaviors. So we need to be honest. Starting at young age with home-cooked food and healthy food, this is the best way to go, knowing that between 0 and 6 months it's breastfeeding for sure that should be used for children.
Lovely. Before we let you go, Mary, let's go ahead in time. Let's talk about the scenario 10 years from now. If you just see the data, what would you predict for, let's say, 2035?
Overweight and obesity will increase. This is a trend that we see. Changes in policies and regulation, this is something that takes time. It takes time to develop, to document why it needs to be done, to develop these policies, regulation, to make them adopted by Parliament and other statutory body, and to implement them. So meanwhile, overweight and obesity will continue to increase. That is why we still need to continue in parallel all the awareness and create more awareness on healthy food. Because the population, if the population does not request healthy food, does not push also the government to make some move faster for this healthy food. So it's kind of a complex but global effort that we all need to make together. The population, the media, the government, and if we work together, then maybe we will have increase in overweight and obesity, maybe not as much as we expect to see. So we have choices today.
Yeah.
We need to make them.
There's time still for course correction. Thank you so much for that wonderful conversation and for putting all the facts together for us, Marie. And here's to hoping people start their day with the right breakfast. And that's the story every day, on an everyday basis. Thank you.